Lisa from New York. Lisa, are you there? Lisa from New York.
Hello.
Hello. Is this Stephanie
Hello.
or Lisa?
It's
Hello?
Lisa. Hello.
Hello. Can you hear me?
Can you hear me? I
Yes,
can hear you. Can you hear me?
Yes,
Hello?
Lisa, you are live on the radio. Are you with us?
I'm here.
Okay,
and I'm
good.
calling for this cough.
Okay, so
12 years of this. Been two allergists, 3 pulmonologists, 2 GIs. Had surgery on my nose, 2 ENTs. Let's see, where else did I go? Periologist. Nothing is negative or positive. Everything's negative. But yet I cough every morning until I throw up. And I cough like this all day long for absolutely no reason.
And how long ago did this start?
12 years ago.
After what?
After a virus.
Okay, so
you had a bad
viral.
virus.
How do you know it was a virus?
Well, because I'm a nurse, and it was viral. It was all clear mucus, fever, body aches. It wasn't bacterial. It was gone within 7 days.
Okay. So do you have any other chronic health conditions, high blood pressure, type 2 diabetes?
Nothing. I take Loratab for the cough. It does control it. Like right now it's controlled.
Okay,
what's your height? Controlled cough.
Okay, good. What's your height and weight?
I'm 5'7.25" and I'm about 160 pounds.
160?
160.
Okay. And have you lost height in the last decade? Are you shorter than you used to be?
No.
You're not.
No, I'm still the same height.
Okay. And you have no other health complaints. You're ringing in the ears.
No ringing in the ears. So the only thing I have is herniated discs, which make my left leg numb.
Okay, very good. So that's where I was going with the losing height thing. You know, there's a saying in medicine, you're a nurse, God love you. We love nurses, by the way. And I'll tell you a story about that in the next section. There's a saying in medicine that when you hear hoofbeats, you think about horses before you think about zebras, right? You think about the most common things that cause things before you start thinking about more, esoteric things. So with a chronic, unyielding cough that is completely, all the diagnostic tests have been run and everything comes back normal. There's no tumor pressing on the pneumogastric nerve. You don't have emphysema. There's no structural change in the lungs, and your blood work looks fine. However, there's a strong and persistent symptom. The most common cause of a strong and persistent symptom in that case is degenerative disc disease. Now, one of the way that degenerative disc disease shows up is with herniated discs. Basically, what's happening here is the intervertebral discs have lost their structural integrity. They have run out of the raw materials that they need to stay healthy. And when the discs run out of the raw materials that they need to stay healthy, they start to become compressed like a feather pillow that's lost its feathers. Now, if that disc that comes out of your thoracic spine, where the nerves come out of your spinal cord that go to your lungs, if those discs have been compromised, and if they're pressing up against one of the nerve or the nerve root that goes to your lungs or to your larynx, it's going to produce a chronic, persistent cough. It's like sciatica. It's similar to sciatica. It's a chronic, persistent irritation of the sciatic nerve caused by a structural anomaly. So the first thing that I would do is I would assume that this is a disc problem, and therefore I would get on board with a medical nutrition program that supports and promotes the health of intervertebral discs, because we got nothing to lose into this bargain, and it sounds like a pretty smart approach to do. Now, when somebody said something this persistent for this long, the recommendation is a 3-month program. So here it is. We're going to dial it in. We have a minute left in this segment. I'm going to dial it in real quick. Here's what I would do if I were you per month. These are the supplements that I would order.